When the landmark Aged Care Royal Commission finally reported last week, there was a collective gasp among much of the industry. It shined a light on ill-equipped providers, a perpetual lack of training and an almost universal feeling that things could not go on as they have been. What was almost absent, though, were recommendations specifically related to sexual assaults in aged care. We know this is an endemic issue. 2,520 sexual assaults occurred in residential nursing homes in 2018-19. That's almost 50 a week. Margarita was in her 90s when she was sexually assaulted in her aged care home. In 2018, she became the first older woman in Australia to publicly share her story in this video. The Drum's Eliza Harvey has more.
For I have loved thee very long, delighting in your company.
Beautiful.
Very slow.
Margarita Solis was a retired nurse who moved into her aged care home at 90. 4 years later, she was sexually abused by the manager of the home.
It's just as though because you're old, you're not worth anything. And you're just young people in an old body. You're no different, not till you look in the mirror.
Margarita kept the abuse secret because she feared people would blame her. She finally told a trusted staffer at a nearby activity centre who helped her report it to police.
I never thought it would impact me the way it did. You know, I've had much worse in my life, really, and I just couldn't talk myself out of it. I'd try and be logical and say to myself, come on, you know, he wouldn't dare come back here. But at the same time, if I heard a footfall outside, that was sleep gone for the night. In fact, I slept with the lights on, really, for over a year.
In the wake of the Aged Care Royal Commission, providers will be compelled to publicly declare that incidents like this have occurred. However, the seriousness of the incident will be decided by staff on the back of the perceived impact of the abuse. For Margarita, that impact was clear. She withdrew, stopped eating and dropped nearly 20 kilos before reporting her abuse.
I found the sexual assault people very helpful, very kind, and they helped me to vent my anger against him, which was a release, because I was very angry, because I felt that people like that think that you're nothing. They can do what they like and you can't do anything about it. And if you speak up, then you are doing something about it.
Wonderful, brave testimony. For more on this, we're joined in Melbourne by founder and director of Celebrate Ageing, a program challenging ageism and preventing elder abuse, Catherine Barrett. Hi, Catherine. You worked with Margarita to produce that film, which, as we said, the first time an elderly woman had spoken about sexual assault. It remains extraordinary. What is the legacy of her bravery in speaking out like that?
I think what Margarita has done is created a real visibility, not only around the problem of sexual assault, but also too around the silencing. So Margarita's sexual assault occurred in a seniors rental service, and everybody that she told, up until she spoke to the worker in the seniors activities service, you know, she was dismissed and she was discredited. And it really took a lot of courage on her part to continue through the process of reporting. And so there's a really important legacy that not only has Margarita raised visibility on the topic, but also too on the impacts that it has on older women. Margarita talked about losing weight, not being able to sleep, and she also spoke about losing faith in humanity. and that she didn't know who she could trust anymore. And I think that's incredibly important because we know that the recent KPMG research on that looked at staff working in residential aged care, 58% of the staff said that sexual assault or rape had no negative impacts on the victim. So that's a really stark contrast with Margarita's message that she was devastated actually, and it wasn't until she found people who were willing to listen to her that she started to learn to trust again, she started to sleep again, and she started to regain weight. So this is devastating. And we know that in the broader community, 94% of people who are sexually assaulted suffer PTSD. Why would we think that it wouldn't have a negative impact on older people? I mean, that's surely ageism and sexism.
And we think about who is vulnerable to sexual assault. You know, we're conscious that the ages from 15 to 19 are very vulnerable times in a woman's life. But if we read that there are 50 assaults a week, and we imagine that perhaps that's the tip of the iceberg, that would suggest that women are equally vulnerable at the other end of their lives. I mean, you're an expert in this field. Is that true?
Yeah, look, they are. I'm not sure about equally, but incredibly vulnerable. And there are some unique factors. And having a diagnosis of dementia is one of the factors. We know that in residential aged care that it is women with dementia who are more likely to either be targeted by perpetrators who think or know they can get away with it because an older woman either won't be able to report or won't be believed. And the other factor as well too, that an older woman can't call out. An older woman with dementia may not be able to call out for help. So this is a particular issue for older women with dementia. But I think that if we look at the factors that make older people and older women in particular vulnerable to sexual assault, it's ageism. It's our not wanting to hear that
a
an older
95-year-old woman would be raped, presumably on the basis that you imagine it to be a crime of passion rather than a crime of power, and therefore how could she possibly be vulnerable? Is that the idea?
Yep. And the myth that sexual assault is about sexual attraction and older women aren't sexually attractive, so therefore they won't be. And if there is an older person's equivalent to dismissing an allegation of sexual assault, if in young women it is what was she wearing, what was she doing out at night, with older women, we find time and time again she must have a urinary tract infection. So this total dismissal of...
So this is not the result of a rape or unwanted sexual contact. She's just got a UTI some other way.
Yes, and I was contacted recently by a family. Their mother had reported a rape in a residential aged care home, and she was sedated. And they had terrible trouble managing her sedation because as much sedation as they could add in, she kept saying that she was being raped and was becoming more and more agitated. And people weren't looking at the possibility that she was saying that she had been raped because she had been raped.
Right. Murray, can I turn to you? I mean, you have worked in this area from a policy perspective under the Hawke government, under the Whitlam government and in the years preceding the Whitlam government. But I want to talk to you about your own experience, about when your mother was in residential setting. And you were fearful about this then.
Well, yes. I mean, this is back in the 90s. My mother was in the higher care area. She didn't have dementia, but she was very frail, and she was towards the end of her life. She kept on, every couple of weeks she'd be taken off to hospital and then they'd stabilise her and so forth. And she was in great terror because there were ambulatory patients, male patients from the dementia ward wandering past her door and often coming in. And she was genuinely terrified of what she could do to try to prevent being abused. Now, I'm not saying she was, but it was a really genuine fear for her. And I think, you know, it probably reflected that sense that who was going to believe a woman in her late 80s? Where were the staff who were trained to properly manage people with dementia who were capable of wandering around? It was among the very worrying things about her last months.
Yeah. Well, from next month, the government is introducing a serious incident reporting scheme, compelling aged care providers to report incidents like neglect, unreasonable use of force and unexpected deaths. Then from October, they'll be required to report all incidents of resident-on-resident sexual assault, the first time that's ever been a requirement. But how seriously a case of sexual assault is dealt with, what priority it's given by the authorities, will depend on how staff perceive the physical or psychological impact on the victim. And advocates like Catherine say the idea that such an incident wouldn't impact an older woman, including some with memory loss or dementia, is astounding and contrary to everything we know about sex abuse victims, regardless of their age. Well, Catherine, the Royal Commission pinned its hopes on this scheme, the Serious Incident Response Team, not reporting scheme, response scheme. Why would the cornerstone of it be trying to prioritise incidents of unwanted sexual contact? I mean, why would you need to give them a priority? Where's that come from?
Well, I think part of where it's coming from is, concerns about the burden to staff who are working in residential aged care. But I think what we've got to do is take a couple of steps back and look, as the Royal Commission did, and look at residential aged care and say, well, what is happening that we're saying that in the reporting that we're not looking seriously enough at sexual assault, because that could be a burden to staff. There's something incredibly wrong here. This has to be taken seriously, and by taken seriously, it must not only be reported. Every incident of sexual assault must be reported, but the reporting can't be done for any other purpose other than to do something about that. We must be looking at that data and saying, well, what's happening here, and what resources do residential aged care service providers need to stop this from happening? That must be the purpose for collecting the data. It has to be.
And Rebecca,
Can I?
Yes, go,
Sorry.
Mari, you speak.
I was just going to say we've had a terrible week, or more than a week, of reports, public discussion of allegations of sexual attacks, some of an historic nature, some of them much more recent. One of the things that has produced has been an amazing outpouring, particularly on social media, of women who have never before disclosed reporting episodes of sexual abuse in their lifetimes. And I think that what is happening here in aged care is, in a sense, absolutely no different from what is happening in the rest of society. There is, regrettably, an unwillingness to take women seriously. I mean, I have been appalled, I think I can't more strongly stated, to have 2019 images of the Prime Minister saying women must be believed, and then when an allegation arrives, he says, the person in question has denied it and I accept it. Now, we have a dilemma in modern society about willingness to accept that women of all ages are subject to unwanted sexual advantages. They must be believed and action must be taken to deal with the consequences for the people who are responsible.
And we emphasise
well
again,
said.
Christian Porter has strongly denied those allegations. Now, Rebecca, you sit on a board that oversees residential aged care, quite a large residential aged care service. So under this scheme, the definition of whether something needs to be reported is whether staff judge that the incidents have caused physical or psychological injury or discomfort that requires medical or psychological treatment. Do you think that's sufficient, given what we're talking about is unwanted sexual contact?
Yeah, well, I guess...
or inappropriate sexual conduct, they're the two.
In our organisation, we would take our own rules about these things, about what needs to be reported, whether it's to police or internally, and what action has to be taken.
And are you comfortable that your staff get to decide that, when we know from that KPMG report that Catherine referred to that 58% of staff thought that if the victim had a cognitive impairment, she may not have any physical or psychological impact from such unwanted contact?
And obviously that's a very great concern, and all of this means that there needs to be continuing and constant reinforcement of the cultural values, which are elderly people are to be respected just the same as anybody else. If an elderly person complains about something, that has to be taken seriously. But staff are also there should be there as advocates for the people they're caring for, because if the older person has dementia or some other condition which makes it hard for them to report, then the staff have to be there to do it for them. And as an organisation, we have to empower them to be able to do that, to celebrate people who actually become advocates for the people they're caring for, and to take action.
Catherine, can I just underline, though, that from April till October is what you're saying to me, that even a rape in aged care might only be prioritised if, and I don't want to disparage aged care workers, but if untrained or semi-trained, low-paid, overworked staff make a judgment that perhaps a cognitively impaired resident was actually injured by that rape. They're the only circumstances in which that would be reported. Is that right? Or are we required to
Well,
be reported?
Alan, it's actually all residents, so not just residents who are cognitively impaired.
Right.
So the assessment is on staff working in the aged care home, and the comments from the previous speaker about that beautiful approach in the best of residential aged care homes, which is advocacy and genuine caring and really, really listening. We know that can happen, but the Royal Commission is telling us that it doesn't always happen. And the KPMG report is showing some real red flag signs of concern. And what I understand from the Serious Incident Response Scheme is that we are, in the first instance, is reporting incidents where staff are seeing an adverse impact on the resident, and you know, if we extrapolate across the KPMG findings, that if staff aren't seeing sexual assault as having negative impacts, and that includes rape, they're not seeing it as having a negative impact, we've got a real problem. Because I think we are not educating sufficiently, empowering the workforce to understand the kinds of things, the community expectations. The community expectation, this is taken seriously. Older people have the right to be safe in residential aged care, deserve respect, and we have to educate and empower the workforce so they understand their responsibilities and that they know what to do.
And rape is a crime. And rape is a crime. And you are required to report crimes to the police. So
Currently, would you?
Yeah, absolutely.
In your
But if I could interrupt, there was ABC reported on a story in Rockhampton 2 weeks ago, and there was a 5-year delay, and that was a rape by a staff member of a resident. It was witnessed by another staff member who reported it, was silenced by management, and it took 5 years for that staff member to step up again. So, you know, we have inconsistencies.
Yes,
we have
quite
good
so.
practice,
Yep.
and we have inconsistencies.
Okay, and we will move on, but to a related topic. But I will note that recommendation 100 from the Royal Commissions talked about this serious incident scheme, and it suggested that the quality regulator publish the number of serious incident reports at a service level. So that's a very important thing for consumers to be aware of and elders to be aware of, that recommendation is sitting there, and we will be watching very carefully to see whether it's implemented.